Hey everyone, welcome to a deep dive into TissueCypher.
Woo, exciting.
Yeah, it's a really fascinating technology that's helping gastroenterologists provide better care for their patients with Barrett's esophagus.
Right.
If you're listening to this, I imagine you're probably looking for a clear picture of how this all works.
Absolutely.
And we've got some really interesting material to break down for you today.
Yeah, we do.
We've got expert testimonials, we've got some scientific research, and even a look inside the lab where they process these biopsies.
It's going to be a great deep dive.
I think so too.
Yeah.
What's really interesting about TissueCypher is that it can actually predict the risk of esophageal cancer,
Right.
which is a major concern for people with Barrett's.
Huge.
And, it's pretty alarming, but cases of esophageal cancer have actually increased fivefold since the 1970s.
Yeah, that's a scary statistic for sure.
It really is. So before we get into the nitty-gritty, can we take a step back for a second?
Sure.
For those who might not be as familiar with the topic, what exactly is Barrett's esophagus?
Okay, so Barrett's esophagus is a condition where the lining of your esophagus changes
Okay.
and it starts to resemble the lining of the intestine.
Mm.
It's often caused by chronic acid reflux.
Ah, I see.
Barrett's itself isn't inherently harmful,
Okay.
but it's what we call a precancerous condition.
Oh, so it has the potential to develop into something more serious.
Exactly. It can potentially develop into esophageal adenocarcinoma, or EAC.
EAC.
Yeah, EAC for short, which is a very serious type of cancer that's unfortunately often diagnosed at a late stage.
And you mentioned that 5-year survival rate for EAC being less than 20%.
Yeah,
That's a really frightening statistic.
absolutely. It is.
And
It underscores the importance of early detection and risk assessment.
For sure. So it sounds like being able to accurately assess that risk is absolutely critical for these patients.
Couldn't agree more.
So how do doctors traditionally assess that risk?
So traditionally, doctors have relied on a method called dysplasia grading.
Okay.
It basically involves looking at how abnormal the cells are growing in the esophagus, and they also consider other clinical factors to try and determine the level of risk.
I see. So is dysplasia grading like a foolproof method?
Well, the problem is that dysplasia grading can be quite subjective,
I see.
and this can actually lead to some patients being misclassified.
Oh, so their actual level of risk might be different from what the dysplasia grading suggests?
Exactly. And there's actually research that shows that a significant number of patients who eventually developed
EAC.
were initially diagnosed as non-dysplastic, meaning they were thought to be at low risk when in reality they were not.
Wow, so that's a pretty big gap between the assessment and the actual outcome.
It is, and it really highlights the limitations of traditional methods and the need for more accurate ways to predict risk.
So is that where TissueCypher comes in?
It absolutely is. TissueCypher is kind of a game changer in precision medicine for Barrett's esophagus.
How so?
It leverages artificial intelligence
All right.
to analyze a standard biopsy sample, and it provides doctors with a wealth of information, including a personalized risk score, a risk class, and even a 5-year probability of the patient progressing to high-grade dysplasia or cancer.
Wow, so it sounds like it's giving a much more individualized and precise picture of a patient's risk.
Exactly. That's the beauty of it.
So how does it actually work? I mean, it sounds incredibly high-tech.
Well, imagine you're trying to understand traffic patterns in a city.
Okay.
If you only look at the overall number of cars, you're missing crucial details, right?
Yeah, that makes sense.
But if you're able to analyze each car's individual movements and its location, you gain a much deeper understanding of the overall traffic flow.
Right.
TissueCypher works in a similar way.
Ah, I see.
It utilizes a technology called spatialomics.
Spatialomics.
Yeah, so it's not just looking at whether certain biomarkers are present or absent, it's analyzing their precise arrangement within the tissue sample, like those individual cars in traffic.
So it's taking into account the spatial context of those biomarkers.
Precisely. And this provides a much more complete and accurate picture of the risk of cancer.
That's really interesting. So what actually happens to the biopsy sample once it's taken from the patient?
Picture this. Those tiny biopsy samples taken during an endoscopy are sent from all over the country to the TissueCypher lab in Pittsburgh.
Okay.
Once they arrive, they're carefully prepared and stained with fluorescent antibodies.
Fluorescent antibodies.
Yeah.
So they're kind of lighting up these specific biomarkers.
Exactly. These antibodies target 9 specific protein biomarkers.
9?
Yep, that are associated with cancer development.
Wow. 9 biomarkers. That sounds incredibly complex.
It is, but it allows for a very thorough analysis.
So what are these biomarkers and why are they so important?
Each of them plays a specific role in the intricate process of cancer development.
Okay.
So, for example, there's P53, which is a tumor suppressor gene.
Okay.
There's P16, which helps regulate the cell cycle.
Mhm.
And there's a whole host of others like AMXC, KOX2, HER2/neu, CD68, CD45RO, and HIF1 alpha.
Wow, that's a mouthful.
It is. There are a lot of players involved, but by analyzing all of these biomarkers, we can gain a much clearer understanding of the patient's risk.
So after they stain the biopsy for these biomarkers, what happens next?
Well, next, high-resolution scanners capture images of these stained biomarkers.
Mm.
And this is where the AI magic really comes in.
Oh, AI steps in.
Yep. Sophisticated algorithms then analyze millions of data points from these images, looking for 15 specific features that have been proven to correlate with disease progression.
So it's like having this superpowered detective looking for clues that we wouldn't be able to see with the naked eye.
That's a great way to put it. The AI is able to pick up on subtle patterns and nuances that traditional methods might miss.
That's incredible.
Mm.
But how does all this information actually impact what doctors do for their patients in the real world?
Let's say a patient comes in for their regular endoscopy,
Okay.
and their biopsy is analyzed with TissueCypher.
Hmm.
If the results show a high risk of developing cancer, the doctor can now be much more proactive.
In what way?
Well, they might recommend more frequent screenings, for example,
Okay.
or they might even consider early intervention with treatments like ablation therapy.
And this could potentially prevent a cancer from developing altogether.
That's the goal. Early detection and intervention can make a huge difference in the outcome.
So TissueCypher can basically lead to what you might call upstaging,
Exactly.
where doctors are taking more aggressive action sooner based on this personalized risk assessment.
Precisely. And on the other hand, if a patient's TissueCypher results come back showing a low risk,
Okay.
this can provide a lot of reassurance.
Sure. Yeah, peace of mind.
Exactly. And it might support a less aggressive approach.
Like just monitoring the condition over time.
Exactly.
Right.
This is what we might call downstaging.
Downstage.
Yeah, and it can spare the patient from unnecessary procedures and the anxiety that comes with them.
That makes a lot of sense. So it seems like TissueCypher is really helping doctors move away from a one-size-fits-all approach
Absolutely.
and move towards a more tailored treatment plan that's specific to each patient's individual risk.
It's all about personalization and precision.
Are there any studies that show how this is playing out in real-world settings?
There are some really compelling
Oh,
examples.
great. I'd love to hear about them.
For instance, there was a study from the Geisinger Health System,
Okay.
and they found that TissueCypher actually influenced management decisions for a whopping 55% of the patients in their study.
Wow, 55%? That's a huge impact.
It is. And another study by QRE Healthcare showed that doctors who were using TissueCypher were much more accurate in assessing patient risk.
Okay.
And as a result, they were able to recommend the most appropriate treatments.
That's fantastic. So it's really making a tangible difference in how doctors approach Barrett's esophagus.
It really is. It's shifting the paradigm.
So are there any official guidelines or recommendations that acknowledge the importance of this technology?
Yes, actually, the American Gastroenterological Association now recommends TissueCypher for risk stratification in patients with Barrett's esophagus.
Wow, so it's gained a lot of recognition within the medical community.
It has, and it really speaks to the growing confidence in the technology and its ability to improve patient care.
That's impressive. It sounds like TissueCypher is really shifting the paradigm from a reactive approach,
I agree.
where we wait for signs of trouble,
Right.
to a much more proactive approach,
Yes.
where we can identify those high-risk patients early and intervene before cancer even has a chance to develop.
Exactly. It's all about prevention and early intervention.
And that must be so reassuring for patients, knowing that they're getting such personalized care.
Absolutely. It empowers them to take control of their health.
So we've talked a lot about the science behind TissueCypher
We have.
and how it's being used in clinical settings.
Right.
But I'm curious to hear some real-world examples of how it's actually making a difference in patients' lives.
Sure, there are many stories that illustrate its impact.
Okay.
One that comes to mind is a study from the University of Southern California,
Okay.
where they started using TissueCypher for patients with non-dysplastic Barrett's esophagus.
So these are patients who wouldn't typically be considered high risk using traditional methods.
Exactly. They might have flown under the radar before.
Interesting.
And the results were really quite remarkable. They found that TissueCypher actually influenced their management decisions for a remarkable 50% of these patients.
Wow, 50%. That's incredible. So they were able to identify a significant number of patients who might have otherwise gone unnoticed.
Precisely. And that's the power of this technology. It can
Hmm.
help us identify those who are at risk, even when traditional methods fall short.
So what kinds of changes do they make to their management based on the TissueCypher results?
It varied depending on the individual patient, of
Yeah, yeah.
course, but for some it meant stepping up surveillance.
Okay, bringing them back for checkups more often.
Exactly. And for others, it meant recommending ablation therapy.
Okay, so that's a more proactive treatment approach.
It is, and it has the potential to prevent cancer from developing.
So they were able to take early action and potentially save lives.
That's right. And it's not just about the medical decisions either.
Oh, what else did they notice?
Well, one of the doctors involved in the study actually mentioned how TissueCypher changed the way they talked to their patients.
That's interesting.
It did. For patients with low-risk scores, it provided a lot of peace of mind.
That's great. Less anxiety about developing cancer.
Exactly. And for those with high-risk scores, it allowed them to have more informed and productive conversations about the need for early intervention.
So it really empowered both the doctors and the patients.
I think that's a great way to put it.
It sounds like TissueCypher isn't just changing medical practices, but it's also empowering patients to take a more active role in their health.
Absolutely. It's giving them the information they need to make informed choices about their care. It is fascinating, isn't it?
It really is. It's incredible how TissueCypher can analyze these tiny molecules and provide such a comprehensive understanding of cancer risk.
It's a testament to the power of precision medicine.
It really is. It's
Mm.
like having this detailed map that guides doctors toward making the best and most personalized treatment decisions.
You don't agree more.
But let's bring it back to the listener for a moment.
Sure.
If someone is diagnosed with Barrett's esophagus, why should they care about TissueCypher?
That's a great question. And the answer is simple. Because it could potentially save your life or the life of someone you love.
Wow, that's powerful.
If you or someone you know has Barrett's esophagus, TissueCypher offers a level of personalized risk assessment that simply wasn't available before.
It sounds like it really empowers patients to be more proactive about their health,
Absolutely.
to have those informed discussions with their doctor, and to make decisions that are right for their individual situation.
It's all about taking control of your health.
And while TissueCypher is a relatively new technology,
It is.
it has incredible potential to change how we manage Barrett's esophagus.
I agree. Early detection and intervention are critical in the fight against cancer, and TissueCypher offers a real beacon of hope.
It really is about moving from a place of fear and uncertainty
Yeah.
to a place of knowledge and empowerment.
Exactly. Giving patients the tools they need to navigate this challenging condition.
So as more research is done, we'll continue to learn even more about what TissueCypher can do,
Absolutely. There's always more to discover.
further solidifying its place as a cornerstone of personalized medicine for Barrett's esophagus.
I believe so.
I want to thank all of our listeners for joining us on this deep dive into the world of TissueCypher and Barrett's esophagus. We hope you found it informative, engaging, and maybe even a little bit inspiring.
It's been a great conversation, and I hope our listeners feel empowered to take an active role in their health and to advocate for themselves if they have any concerns about Barrett's esophagus.
Absolutely.
Yeah.
Knowledge is power, and we encourage everyone to keep learning and asking questions.
And remember, you're not alone. There's a wonderful community of support out there for people with Barrett's esophagus and their families.
We'll be back soon with another deep dive into a fascinating topic. Until then, stay curious, stay informed, and stay well.